Hi, I'm Dr. Anastasia and this is Sage Health TV. Today I want to talk to you about the COVID antibody testing. So it's a new topic, it's kind of a big topic, so I'm not going to get too deep into all of the science around it. I just want to talk to you a little bit about what we know now. Today is April 23rd, 2020, and the reason I'm telling you the date is because things are changing very rapidly. So I'm going to share with you sort of what's been available from reliable sources regarding the antibody testing, what types there are, and how it can benefit people to get tested. So over the past week, several companies have rolled out antibody testing, and that's a little different than the testing that's been available. So I'm going to explain what an antibody test is and what it can tell you and what it cannot tell you. So first off, what type of testing is available? The first type of test, which is the one that's been in short supply, that people have been talking about for the last 5 or 6 weeks about needing to get more of, that is not an antibody test. Those are the nasopharyngeal or oral swabs, and what those do is test for the presence of the actual virus in your body by picking up antigens. And viral antigens are actually a tiny little, basically, RNA fragment of that virus, which is present in the tissue. So those are the tests that are still being done to see if people are currently infected, and those are still in short supply. The second test and the tests that have come out this past week are antibody testing. And what those tests are basically, what an antibody is, to let you know, is really our own body's immune response to a virus or to another outside offender. It doesn't always have to be a virus, but in this case it is. And what we're looking at when we're looking at antibodies essentially is a little Y-shaped protein produced by our white blood cells to respond to or stop a viral attack. Now, this is typically, with an antibody test, it's typically a serology test, and what that means is it involves a blood draw. But some of these tests also can be done by finger stick. And the results are looking like they take anywhere from a few minutes on the finger sticks to a day or two on the blood testing at this point. And really what they do is they test whether or not you have had the virus. And I want to be really, really clear about this, even though there's just so much information unfolding on a daily basis. The thoughts coming from the CDC right now is that possibly around 50% of people who have had the virus, meaning they've been exposed to it and even mounted a little bit of an immune response, have not been symptomatic. That means a huge number of us can be walking around asymptomatic as carriers of this virus or had it, right? And so basically what we're looking at on these tests, there's two types of antibody testing. There's IgM. IgM antibodies are those first responders that come on the scene, right? They, within a couple of days typically, they come on, they develop a very specific kind of attack on the virus, and then as quickly as they've come in, they sort of leave. And then the second wave comes in, and that's IgG. And that's what we're really talking about here when we're looking at past exposure and potentially long-term possibility of immunity. Now, IgG is an antibody that our body develops. Typically, once again, we're going a lot based on our understanding of similar viruses or past viruses, but typically those antibodies are developed and come on the scene within 7 to 14 days, right? Whereas the first wave comes in about 2 to 7 days. So there's a little bit of an overlap with them. And what the IgG does is it is that immune response that sticks around usually. So it could stick around for months, sometimes for years, but we don't know that yet. So with this test and with any antibody testing, one thing that's really important is you're getting it from a reliable source. So many have come out recently. One of the ones that's come out that is, I think at this point, and this could change very quickly, the only, if not the only, maybe one or two that actually has the FDA approval for an EAU, and what that is emergency or authorized emergency use. And it means they've put it through really rapid testing and really tried to look at the specificity and the sensitivity. And specificity is how specific these antibodies are to that virus. The Abbott platform test, which is the approved one and which is the one we use with our in-house lab Quest, has a 99.4 specificity, and they're thinking a fairly high sensitivity, which means there still can be some false positives, but not a lot, and that percentage is still pending. So what does the testing tell us? One, an IgM test can tell us if you're still in a fairly acute phase of the infection. An IgG test can tell us if you've been exposed, if your body's mounted an immune response, and if you have potential immunity to it. And the reason I say potential is because that's still unknown. Typically with viruses, if you have mounted an antibody response, there is some persisting immunity. We don't know how long. It has a lot to do with how much that virus replicates. A good example would be the flu. A lot of people get the flu and they can get it the next year or the year after because not how fast it replicates, how quickly it mutates. So right now they think that the flu influenza viruses mutate about 10 times faster than the coronaviruses. So that's a positive thing. But once again, at this point, we can't say whether or not a positive IgG means you are immune to reinfection, but it is thought that there's a good chance that people will be less susceptible to a reinfection, and that's still a positive thing. Also, getting antibody testing on a larger scale can let us know, really help researchers and people involved in learning more about this virus see the patterns of infection, patterns of reinfection, and also possibly help with the development of vaccines and other supportive measures. So if you have any questions about the antibody testing, if it's something you're interested in doing because you think you may have had an exposure or you want to know just kind of what your status is, that's something that we can help you with. You can find more information on our website. Thanks for listening, and we'll see you soon.